Tēnā koutou, nau mai haere mai. Welcome to the third talk in our spring talk series, Psychology Bite-Sized, brought to you by Te Kura Mātai Hinengaro, School of Psychology of Te Herenga Waka, Victoria University of Wellington. It's a huge pleasure for me to introduce today's speaker, who is Dr. Dougal Sutherland. He's a registered clinical psychologist and has been working with young people, children, and adults for many, many years, and has a lot of expertise not only working with them, but also teaching our next generation of clinical psychologists, much needed, as if you've followed the news in this country, to become clinical psychologists. So that's really important work there as well. You might know Dougal from TV, from the radio. You might have read something that he wrote. He basically guided us through this pandemic, and still does, explaining our emotions, explaining how people react to all these different changes that happen on a really daily basis. And today he's gonna talk about what do you need to know about anxiety in children. And I guess we are not talking about Halloween scare, are we? Okay, as usually, Dougal is gonna share his talk with us first, and then please keep writing your questions into the Q&A box, and we will bring them up later and discuss them towards the end. Please, you can just type them into the box, and I'll bring them up later. Looking forward to hear now more about anxiety in children, Dougal.
Oh, well, thanks, Hedwig, and tēnā koutou katoa, everybody. Thank you for joining us. I appreciate that it is 5 p.m. on Wednesday, and if you're joining, you are extra special because, yeah, it's a big ask, you know, because it's easy not to do something at 5 o'clock on Zoom on a Wednesday night. So appreciate you joining and hope you get something out of this. Let me tell you a little bit about me, or a little bit more. Hedwig's already told you a little bit, and then I'll share some slides with you and we can talk and go from there. So yeah, I'm a clinical psychologist. I'm originally, my whakapapa back is to Dunedin. I was born and bred there. As my name might be a bit of a giveaway, my genealogy goes back to Scotland on both sides of my family pretty rapidly. So yeah, we're good Scots Presbyterians. I grew up in Dunedin, did all my studies down there and started working there, and then moved up to Wellington around 20 years ago. I worked in DHBs for about 15 years, and then for the last 6 or 7 years, I've been here at Victoria Uni, where I teach in the clinical psych training program, which involves a clinic as well, where we see members of the public. And I also do some work on the side for an organisation called Umbrella Wellbeing, and we do mental health and resilience training in workplaces. So yeah, so that's a little bit about me. And I'm going to share my slides now so that we can get into it. So hold on 1 second while I click the right buttons, and you should be able to see those. Cool. So I've bravely titled this "Everything You Need to Know About Child Anxiety," and you'll see 2 names on there, obviously mine, but also Professor Karen Salmon. So Karen is Professor of Child Clinical Psychology here at Victoria, and essentially this is her information. And so you could think about it that Karen's the brains and I'm the mouth. And so, yeah, so really want to acknowledge Karen. I also want to acknowledge that whilst I've titled it "Everything You Need to Know," it's probably not everything you need to know about child anxiety. It is some things. Yeah, as Hedwig said, if you've got questions as we go along, just throw them into the chat function. I'm going to try and stop speaking with about 15 minutes to go so that we can answer any questions you may have. Of course, if you don't have any questions, we can just finish early and you can go and have dinner. So either way, we'll win. Okay, let's start with a bit of a whakatauki. Poi poia to kākano kia pōwai. So nurture the seed and it will bloom. So this really, to me, sums up that whole idea of we need to be nurturing our kids. And anxiety is one of those things that really, if you've known any kids with anxiety or you've been anxious yourself, you know the battering effect anxiety can have on your well-being. And hopefully by working with kids, helping kids when they're anxious, will help nurture them so that in later life, or even in the very near future, they will bloom. This is just an outline of what I'm going to talk about today. I'm going to talk about what is anxiety, how common is it, which is, and how it's been affected by COVID, which is, there are often lots of questions around that. What causes it? And here's a spoiler. There's lots of things. There's not one thing in particular. If only there was, it would be real easy. And what can we do about it? How do we help kids when they're anxious? So that's the sort of the overview for today. Firstly, I thought it'd be good to just give you some examples. Let's make this real. By the way, these aren't real examples. These are based on mashups of people I have known whose names have been changed to protect the innocent, essentially. Three examples there, James, Tony, and Emma. Emma, 9 years old, is possibly what you might think of as classically anxious. She worries about everything. She gets a sore tummy when she's anxious. She's clingy to her parents, and she doesn't really want to go anywhere without them. That might be what we often might think of as somebody who's anxious. However, anxiety looks different for different ages and different stages and different genders and different people. James, 11, non-compliant and aggressive at home, refuses to go to school. And worst of all, won't get out of the car to come in and see the psychologist in the clinic. So you can imagine that would be difficult. On the surface of it, James's behaviour looked like some sort of behaviour problems or something like that, but actually underneath it, it's probably anxiety. He refuses to attend school because he's too worried. He gets aggressive because people are trying to force him to do things that he doesn't want to do, including go and see a psychologist. And then lastly, as an example, Tony, 14, she's what you might call a perfectionist. She's good at everything, skilled in maths and science. She's a high achiever, but she doesn't get into competitive situations, and she often has, I've put somatic complaints. Now that's a fancy word. It just means basically there's some stuff that goes on in her body, headaches, stomach aches, her skin gets a bit of a rash. When she gets anxious. So those are some typical examples of kids, young people, Tony wouldn't like to be called a kid, who experience anxiety and kind of what it looks like from the outside. So let's talk a little bit more about what is anxiety. Firstly, we've got to start from the position that anxiety is actually a natural, normal, healthy emotion. It's designed to keep us safe. That's the protective function. All of us will experience anxiety in our lifetime, or feelings of anxiousness, perhaps you want to say it like that, because really that's our brain, our fight or flight system being activated and saying, hey, there's something out here that you think is dangerous, and be alert, be on guard, because this thing could be dangerous. If you think about it developmentally as humans, this evolved out of the times when we were worried about being eaten or beaten. Eaten by a saber-toothed tiger, or beaten up by that terrible group that lived over there that we were at war with. And anxiety is designed to protect us. However, it can go a bit wrong sometimes. Sometimes it gets a bit severe. Chronicity means it keeps going for a long time. It feels uncontrollable and it starts to have an impact on your life. Those examples that we saw before of the kids, James, 11-year-old, didn't want to go to school. Anxiety was having an impact on his life. So think about it as a continuum. At one end, normal levels of anxiety and situations where anybody would feel anxious. But then it starts to come through where it's more unpredictable, more uncontrollable, more severe, more ongoing. And that's when you might start to get into what we call anxiety disorders. And now there are two key components to any anxiety disorder. Firstly, there's the panic. Panic is a physical experience. It's an emotional experience. If you've ever had a panic attack, and I had panic attacks when I was at university, the panic is a good way to summon them up. This is like this feeling of complete terror of what is going on for me. And there's almost always a physical component. Your heart beats really fast. You get sweaty and shaky. You can't sleep. You can't sit still. The other main component that we often find in anxiety is worry. And that's a mental process. So worry is about you worry too much about things that are unlikely to happen. So your mind goes to thinking about what if that could happen? And usually it's associated with the worst case scenario. What if this happened? What if, oh my God, what if the university fell down? I would die and it would be terrible. For kids, when we're working with kids who are anxious, we often use this metaphor of a fire alarm. Like a fire alarm is a really useful thing to have when it rings when there's a fire. So that would be when you have a normal level of anxiety, right? It goes off when there's something that you really should be afraid of. But often when we're dealing with anxious kids in clinical situations, their fire alarm is giving off false alarms. So it's going off too much, too often, and giving you a false alarm. So when we work with kids who are anxious, we often say, hey, look, this is not about you never feeling anxious again ever in your life. It's about tweaking your fire alarm system so that it only goes off when there's something really to be worried about, rather than going off every day about every little thing. So that's an overview about what anxiety is, some of the core components of it. And let's talk about the different types of anxiety that we might see in children and young people. So I've got a list here, and I'll go through, there's about half a dozen, and I just want to give a note of explanation on each. Firstly, separation anxiety disorder. Now, separation anxiety disorder is when you get, and this is typically younger children, around sort of late preschool going into early primary school age, when they won't separate from their parents without some level of distress. Now, again, many of you, if your parents, will know that this is not an unusual thing, right? You've taken your child to daycare and you've kind of had to peel them off you and hand them over to the daycare teacher, and then run quick, get out before they come. So that's not unusual in itself, but it's when this becomes a real problem, and particularly when kids start hitting school, they need to be able to leave you, right? They spend 6 hours a day at school. So separation anxiety becomes a disorder when it really impacts on your life, and kids can't leave school without you, or as soon as you leave school, or when you try to leave school, they have a massive temper tantrum, or they break down in tears. Often what's behind separation anxiety disorder, when you dig in, is kids are worried that something bad is going to happen to them or to their parents. So they worry that the reason mum is late is because she's had a horrible car accident and died. Or they're worried that if they go out and stay at a friend's house, there might be an earthquake and the house will collapse and they'll get hurt. So that's the essence of separation anxiety disorder, is a fear that something bad is going to happen to you or to the people around you that you love. And so you don't want to separate from them. Makes sense in some ways, right? Selective mutism. Now, is this really anxious? Yes, it is, but it doesn't display it like that. So selective mutism is when you get a child or a young person who will not be able to speak in a certain situation. Often that would be at school, but not exclusively. So this might be a child who's pretty quiet anyway, who will talk away okay at home, but when they get to school, they completely clam up and won't say a thing. Usually it's because they're anxious, and not always, but if it's an anxiety disorder, it's because they're anxious about something about being evaluated in that social setting. So they might talk in one. So the selective part is that they don't talk in one or more settings, but they do talk in other places, but typically at home. Oopsie. We jumped to, but that's okay. Specific phobia, these are classic. People know about phobias, right? I'm afraid of spiders. And I've got to say, everybody says, oh, I'm afraid of spiders. I'm afraid of heights. This is more than being just a little bit afraid when you're seeing a spider and go, oh, that's terrible. This is incapacitating fear. This is a fear where I can't go into a room if I even think there's a spider in there. I have a specific phobia of heights. It means I cannot go up 3 floors because I'm so worried. So there's a difference here between what most of us experience as about of, oh, I'm a bit funny on heights or a bit yucky with spiders, to this is a real dread and fear of them. Another type of phobia, but we put it in a different group, is social anxiety. Social phobia, social anxiety, same thing. It's where you have a real worry about how others are going to perceive you and evaluate you in public. And it can get to the point where you don't go out in public because you're so worried that you are going to be negatively evaluated. So people are going to think nasty things about you, say horrible things about you. Panic disorder is when you might experience panic attacks, and that develops into a fear of when you're going to have these. And these are typically starting to develop in later childhood or teenage years. And then generalized anxiety disorder is kind of when you worry about everything all the time, little things all the time. What's going to happen about that? What if that? What if that? What if that? You know, what happens if we don't make it there? What happens if this happens? What happens if that? And there's lots of what ifs, and your mind's preoccupied with these worries. And then lastly, agoraphobia. Now, commonly people often think about, if you say to somebody, what's agoraphobia? They go, is that the fear of being outdoors? It's not really the fear of being outdoors. What it is, it's a fear that you're going to be somewhere in a public place, hence the outdoors bit. And what's going to happen is that you're going to do something, get into an embarrassing, uncomfortable, horrible situation, and you won't be able to escape or get help. And typically people with agoraphobia are worried they're going to have a panic attack, like at the movies, and they won't be able to get help. And something terrible will happen. And so you stop going out. You can see there's a bit of a crossover there with social anxiety. Both of those have the overlap where you don't go out, or perhaps you stop going out or limit where you're going out to. Now, some of these problems, separation anxiety, selective mutism, tend to go away. They tend to get less of those as kids grow up. Some of them, phobias, social anxiety, panic disorder, can continue on and into adulthood. And many adults will relate to some of those. Now, it's useful to think about what's going on in somebody's head. People's always, you know, when you're a psychologist, people are always asking, what's going on in their head? What's going on inside? Well, these are some of the thoughts that are types of thoughts that are going on when people are anxious. So separation anxiety disorder, the thought might be, the thing that's going on in their head is mum might get hurt in a car accident and won't come back. Social phobia, oh my God, I'm going to do something and everybody will laugh at me. Generalized anxiety disorder, I'll fail the test, but for generalized anxiety, you'd also be worrying about what will happen on the way home, and then what's going to happen when you do get home, and will I get to sleep tonight, and what happens if I develop a really severe illness, as well as failing the test. And agoraphobia, I'll feel sick or faint and I won't be able to escape. Now, I'm sure many of you who are watching will kind of go, well, I kind of think that anyway sometimes. And I think that's absolutely true. And that I think shows the normality of anxiety, that many of us will think these or worry about these sorts of things at some time in our life. But when you are sort of preoccupied with being worried about them, that's when we would say it's starting to turn into something more than usual. Now, as you can imagine, trying to explain some of these concepts to a child or a young person can be a little bit difficult because it's a bit technical and we've been using kind of adult language. So often we use, try and use social media or some sort of things that kids can relate to. So I've got a little bit of a clip here that I think nicely demonstrates worry, catastrophic thinking. Catastrophic thinking is, I think there's going to be a catastrophe. The worst thing is going to happen. And so sometimes we show this, particularly to young people, as an example. So I'm going to click on this. It's not too long. It's like a minute and a half, just as a nice example about what you might imagine if you were thinking catastrophically. Except a lot. Here we go.
Dr. Pepper, what's the worst that could happen?
Johnson, Todd Johnson. Come in. Oh! Oh!
Oh, dear.
Now, what seems to be the problem?
Well, I hurt my little friend.
Oh, right. Well, take it out of your pants, Todd. Oh, my gosh. It's swollen.
I got it stuck in a keyhole.
Looks like you need a Band-Aid. But I don't think I have one small enough.
Well, thanks anyway, Nurse Chapman.
He should be more careful where he sticks that thing.
So that's a nice example of what's the worst that could happen. Well, if you have anxiety, you've probably imagined all those scenarios and even more. But often we use kind of video clips when we're working with kids just to help them understand, because it's really crucial for people to understand what's going on for them if they're going to do anything about it. All right, how common is it? How common is anxiety? It's pretty high. It's one of the, and you can see if you think back to a couple of slides ago, there's actually, when we're talking about anxiety, we're actually talking about a group or a family of problems. We're not just talking about one thing. Social phobia, generalized anxiety, panic disorder, selective mutism, we're all those things. So you can see that that's quite a big group of problems there. There is, as you can see on the slide there's a huge range in research as to some people would say, 2% of people are anxious. Others say 41% of people are anxious. Often we often lump anxiety and depression in together when we're talking about prevalence rates, and we say, do you know what? About 1 in 5 people will experience anxiety or depression in their lifetime. So it is pretty common. Sometimes children simply don't come to attention because they don't tell anybody, or because parents don't know. They don't really know what's going on with their child. If you think back to one of those first slides, we talked about James, 11, angry, aggressive, defiant, not going to school, not getting out of the car to see the psychologist. Good Lord. Parents might not see that as anxiety. And so you wouldn't go to a psychologist because all you think you're dealing with is a naughty boy. I've put there too on that slide, there's been some increase in the last 10 years in rates of anxiety that have been reported amongst children. And I put that in because that's a question that we often get asked. Has anxiety increased in the last 10 years? Is it to do with social media? What about the internet? That must be making people worse. So there has been some increase in reports of anxiety. Maybe that's because we know more about anxiety and people are much more willing to talk about it. But I think that the increase also feels more because there's been the increased awareness about it. You've had great publicity campaigns from people like John Kerwin talking about the importance of, mental health, depression and anxiety. And so people are becoming more aware of it. And sometimes I think that has acted to magnify how big the increase in anxiety really is. But we know it's pretty common anyway. If you don't know somebody with anxiety, I suggest looking again because you probably do. They probably just haven't told you. I also wanted to talk briefly about COVID. What's the impact of COVID? Again, a really common question in this day and age. Is COVID making our kids worse? Are they more anxious? There was a UNICEF report released just in September, so just really recently, who said, look, in that report, it said, we're really worried about the impact of COVID on children's mental health. Not so much from the direct impact of COVID, but more likely through things like having reduced access to education, less contact with friends, the economic effects of COVID brings about poverty to families. And there was an estimate that there might be as much as a doubling of levels of anxiety and depression amongst children post-COVID compared to pre-COVID. Now, of course, we're right in the middle of it, so we can't know for sure. We can't know for sure whether this will last. Or whether it's just going to be a little bit of a spike, and then after we've got rid of COVID, who knows how long that will be, or when we settle down with it, at least those levels of anxiety might reduce down. We don't know. So we're sort of in the middle of it and we'll have to wait and see. I would note though, you see that last point there, general triggering impact of major events. What we notice clinically is that whenever there is a big major event, e.g. the 9/11 bombings, or if there's been a highly publicized murder in an area, we often find that is a trigger towards children presenting to the clinically with anxiety. And I think the same thing is that we have seen with COVID, is that COVID might have been the trigger that's led to somebody led to a worsening of somebody's anxiety that was perhaps always or had been there underneath for a while, and that the major event had actually triggered it off. So I can remember when I first arrived in Wellington, I worked in Lower Hutt, and there had been a high profile murder on the riverbank. And we had lots of kids that were coming in worried. They weren't worried about the crime itself, but it seemed like the crime had triggered something off for them. So we do just see this general impact of major world events, and maybe that's what we're getting with COVID as well. All right, what else goes with anxiety? So you see right in the middle there, we've seen up to 80% of kids who have anxiety also have something else going on. So you'll see a couple of common things there. We've got ADHD. So 3 times more likely to have ADHD and anxiety. So those two to go together. If you've got one anxiety disorder, you often have another one, which is a bit of a bummer, isn't it? You know, you think one would be enough, but no, you're more likely to have another one as well. In the bottom left corner, conduct problems. So conduct problems are when kids are, I'm going to use the colloquial term badly behaved, but I'm not talking about just being a bit naughty. Conduct problems are really severe behavior problems, you know, vandalism, breaking things, breaking laws, hurting animals, really getting offside with the law as a child or a young person. That's a conduct problem. And it's more than just being badly behaved. Again, 3 times more likely with anxiety. So these things often go together. And depression, wow, look at that, 6 to 12 times more likely that those two will go together. So you often hear people talking about anxiety and depression in the same sentence. Oh, I suffer from anxiety and depression. And that's because they often do go together. They're kind of different, and perhaps they're not different, but we're focusing mainly on anxiety today. So yeah, lots of other things will go with it as well. All right, what causes anxiety? You notice I've put causes in quotes because it's probably not a useful way to think about mental health. Causing something else is a bit more of a biological approach to things. Like COVID's a classic example. If I get the coronavirus, I will get COVID. That's a cause and effect. For psychology, it's never that simple. There's never, or hardly ever, should I say, just one thing. There's lots of things that contribute to why a person, a child or a young person might feel anxious. And so we're going to talk about each of these as we go through. And I'm only going to spend a couple of minutes on each. So let's have a look. Genetics. That kind of sucks because there isn't anything you can do about your genes, is it? But if your parents were anxious, then it's a bit more likely, probably about 1/3 more likely that you will be anxious compared to somebody whose parents weren't anxious. Now, I can testify to that. As a child, as a young person, I suffered from anxiety. I didn't know it was anxiety at the time. And then as when I went to university, I had some panic attacks. So I suffered from anxiety, and lo and behold, my daughter, I forgot to say, I've got 2 kids myself. The last time I counted, I had 2 dogs, 2 children and 1 wife. The dogs are okay. I don't think they're anxious. Well, actually, one of them does seem a wee bit anxious, but that's another talk. But my daughter, she's 15 now, but when she was 12, 11, she went through her own period of anxiety. Just getting really wound up, sort of panicky type symptoms. Could I take some of the, I won't say the blame because it's not a blame thing. Do I acknowledge that there was a genetic factor probably passed down from me and not her mum? Yes, it probably came from me. So that kind of, but there ain't much you can do about your genes. It's just like your hair color or eye color, it's what you're born with. It is more likely to occur in women than in male. There's a question there about, is it just reported more? Is it more socially acceptable for women to say that they're anxious than it is for men? So, but anyway, we know, let's say it's more reported for women than men. The other thing, and these are sort of things that exist from a very young age. Temperament is what is a way that you interact with the world that you're often born with, and parents will know this. So there's a particular type of temperament. It's called behavioral inhibition, and this is when kids who are behaviorally inhibited as infants and as toddlers, they don't explore the world very much. They seem to be a bit withdrawn, and they seem to be a bit clingy, you might even refer them as. And that's a risk factor for anxiety, particularly social anxiety. And you can see there the mixture between temperament and genetics, because kids who are behaviorally inhibited, who are clingy as young kids, are more likely to have parents who are anxious as well. So there's a kind of an interaction. But also importantly, most kids who are a bit clingy as young as infants and as toddlers don't go on to develop anxiety. So it's not one of those things, you can't just point your finger at one thing and say, that's what causes it. There's lots of different things. What else? Well, negative experiences, and this is particularly for phobias. If you've had a bad experience as a child with a dog, being attacked by a dog, lo and behold, you might develop a phobia for dogs, and that's not uncommon at all. What else? Worried thinking. We know that there are particular ways of thinking about the world, styles of thinking, that tend to be associated with anxiety. Threat interpretations, that's when your brain actively looks around for things that might threaten you. Negative attributional style, that's just a clinical way of saying you attribute bad things to you. Oh my gosh, this must happen because of me. So your thinking is skewed from a young age towards looking for threat and looking for bad things. And lastly, another factor that's involved with anxiety is you learn from others, hence the mini-me slide beside it. So if people around you act in an anxious way, then you're more likely to act in an anxious way as you grow up. Now, it's not that people around you are deliberately trying to teach you how to be anxious, but we all pick up from other people what goes on. So again, those are some of the things that contribute to anxiety. We also know that parents play a role. And I want to be really clear about this, that this is not a way of blaming parents or saying to parents, you have caused your child to be anxious. Because I've never met a parent, and I've met hundreds of parents, I've never met a parent who's gone out to make their child anxious. But do you know what? The way we act as parents, lo and behold, has an impact on our children. So if you are anxious as a parent, and remember genetically there's a stronger chance that you are, your kids might pick up on that. Not that you want them to. You might be inadvertently, we could put here inadvertently reinforcing. What does that mean? What it means is that you might reinforce, not reward them, but when they seek comfort from you, or when they seek to get out of a situation that they find anxious, you might help them to do that rather than helping them to stay in a situation where they're feeling anxious. And we know that staying in a situation when they feel anxious probably in the long term is good because it helps you reduce your anxiety. But parents who are anxious might be quicker to save their kids, if you like, from an anxiety-provoking situation. And so kids, as a result, have fewer opportunities to learn that it's going to be okay. So classically, what happens when you're anxious is that you want to get out of the situation, away from the situation that makes you anxious. And when you do that, you experience an immediate reduction in your anxiety. Oh, I feel better now because I got away. Great. So what are you going to do next time? Try to get away. And what might your parents do? Try to help you get away because they can see that you're distressed and upset. So when we work with kids who are anxious, we do spend a little bit of time working with parents as well, and saying to parents, hey, have you thought about doing it a different way? And I'll come to that soon. All right, how to help. What are we going to do? So this looks like a slightly complicated diagram, but I think you'll get it. What we've done here is that in the orange boxes are the things we've already talked about, the things that contribute to anxiety, and the blue boxes over the top of the orange ones are how we can help. What do we do to help kids who are anxious in each of those different areas? So I'll take you through each of those different areas. Firstly, we know that it's quite possible to help the majority of people with anxiety. And a particularly helpful type of therapy is called cognitive behavior therapy. Cognitive is just really how you think about the world, and behavior is what you do. So cognitive behavior therapy, CBT, many people have heard of CBT. There's a really awesome program for treating anxious kids called the Cool Kids program. It's an Australian program, and it's been really thoroughly researched. We run a Cool Kids program here every year for anxious kids, and it has really great results. At its heart, CBT for anxiety is around helping young people children to get into situations that they're afraid of or that they're avoiding, and help them to learn or to discover that actually they're going to be okay, that the thing that they fear is probably not going to happen. It uses some what we call cognitive restructuring, which is just looking at what you're saying to yourself in your head and seeing if that's helpful or not helpful. And it's really useful for the majority of kids that do it, although it doesn't help everyone. So it's important to say that this stuff is not a magic bullet, that there is no necessarily cure for anxiety, but we know that it can be, lots of people can be helped a lot. So let's dig into a little bit, and I'm just going to go back a wee shake. So we're going to talk about exposure. So, and I'm just going to take you back 1, 2. So exposure there, if you can see it on the left-hand side, exposure is what we might do to help get over avoidance. So remember, avoidance is around, I've been in these situations that make me feel anxious, or that when I've been in them, I've started to feel anxious. And so what do? I avoid them. I stop going there. I stop leaving the house, as a classic example. I stop going to school because that made me feel anxious. So what's the antidote to exposure? The antidote to avoidance is exposure. Fighting fear by facing fear. And this is when kids, and we do this with adults who are anxious as well, by the way. It's not just something nasty and cruel that we only do to children. But you've got to stay in a situation long enough to learn that the thing that you fear is not going to happen. Now, rest assured, we don't just throw kids into their most feared situation and say, there you go, you'll be right. See you in 4 hours. We get that we do it in a step-by-step, a graded sort of step-by-step. We often use the analogy of a step ladder, hence the little pic in the side there of kids on a step ladder. That's kids in Bhutan or somewhere going to school. Apparently that's how they get to school, is up that long ladder. Anyway, that's by the by, nothing to do with anxiety. But what we do for avoidance is help gradually allow kids and adults to get back into situations that they've been avoiding, to learn that the thing that they're worried about is probably not going to happen. And you need to do it over and over and over again. And when you finish doing it over again, you need to do it again. And the biggest task often for parents when we're doing this is helping them not to rescue their kids, because kids might get a little bit distressed, or a lot distressed. If you're doing it well, though, they might get a little bit distressed. If you're not doing it so well, they'll get too distressed, and that suggests that perhaps you've started too high on the step ladder. But a normal, natural parent reaction when you see your child upset is to go and comfort them and take them out of that situation. So I often say to parents, look, we're going to ask you to go against your natural instincts as a parent. It's not going to help them if you go and rescue them. They've got to stick in there long enough that they learn that it's going to be okay. Now, obviously, you don't throw them into something where it's 10 out of 10 on the anxiety-o-meter. You might pop them in. They might choose, and this is actually a really crucial part. They might choose to go into a situation where they feel 3 or 4 out of 10 on the anxious scale. And over time, the 3 drops to a 2, and then a 1. And then a 0, and then they go, actually, this is a bit boring now. And you go, yes, hallelujah. So that's exposure, fighting fear by facing fear. What else do? We look at worried thinking. So remember, we've already said earlier that for parents and children who are anxious, they often think about the world in a negative, catastrophic way. They look for the worst to happen. And I've noticed, remember, I've got a background of anxiety myself. I notice sometimes my brain almost actively scanning, what can I be worried about? What should I be worried about? What am I worried about? That would be looking for threat. So that's my brain. And you see that point there, that third point, it says attentional bias towards threat. My attention is looking out for threat. So I'm more likely to see a threat. And I make this assumption that bad things, threatening things happen to me, not to other people. There's something special about me. And so this is a tricky thing that we have to help parents and kids get around, is actually looking at the world in a different light. maybe there are things about the world that you're not seeing, because it's almost like you're seeing the world not through rose tinted glasses, but perhaps through black tinted glasses. So, but maybe there are other ways of looking about the world. So some of helping them in this regard is helping them see different things that they haven't been looking about. Now, I've got a little video to illustrate this attentional bias. So this that shows that actually we think sometimes we're attending to everything that goes on in the world, but we're not. Now, some of you may have seen this video before, and if you have, that's cool, but not everybody will have. So this is a short test, and I want you to do the test. I want you to take part. I want you to follow the instructions and see how it goes for you.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Go!
So that ad was actually from the UK. It was about looking out for cyclists. But the point is that you don't always see everything that goes on about you, and you can train your brain to look for other things that it's not naturally looking for. So when we're working with kids, and again, we might use that video or something like that to highlight to kids that actually there are things that are going on around them that they're just not aware of, because their brain is tuned to looking at things in a particular way. So it's how do you tune your brain in to look at other things around you? Like, actually, I've done this 100 times before and it hasn't worked out badly. Other people do this all the time and it never works out badly for them. Maybe that's enough to get me into that situation and let me stay in that situation long enough to find out that that's right. The bad things don't really happen. All right. Now, I've only got a couple of slides left, so we're just sort of coming to the end. So if you've got some questions, and I see there's some in there already, feel free to throw them in now, because now's a good time, and so we can get to them. So often when we're working with kids, as I've sort of mentioned already, we're not just seeing the child or the young person. We're typically working with the family, with the whānau. So we might be working with parents. We might be psychoeducation. We use some flash words in psychology, don't we? Which I think sometimes just caused confusion for everybody. Basically, the gist there is it's really useful for people to know what's going on for them. So you might explain, almost like we've done in this talk today, you might explain to somebody when we first find out they're suffering from anxiety, that this is what anxiety is and this is what happens. Because knowledge is power, right? And if you have got the knowledge about what's going on for you, you might have some more power to do something about it. We might have to work with parents on managing their own anxiety, because remember, little people learn from big people. So if big people are anxious, little people might learn that. So it might, and the number of times I've worked with anxious kids and parents have gone to me, I think like that too. It's like, no kidding, me too. So you might have to work as a parent on your own anxiety. We often, when we're working with young children too, it's about us taking control of the situation as a therapist, as a psychologist, and giving that to the parents, and ultimately giving it to the child, but giving that to them in a supported, structured way so kids feel safe. We talk with parents about how not to rescue their kids out of situations. Now, this is all done with the kids' full knowledge. It's not secrets and lies. So kids are fully aware that they're getting into this situation and what's going to happen. And we talk about how kids can learn to manage their emotions, how they can learn to calm themselves down without having to run and seek comfort from somebody else. And I'm not saying seeking comfort from a parent is a bad thing, but when we're talking about anxiety, it can sometimes get in the way and sometimes keep the anxiety going. So really, we're talking about working with the whole family about what you're doing, so that's the behavior, and about what you're thinking, and that's the cognitive bit. Now, lastly, just some recent developments. We know that there's been lots of developments on the internet around internet-delivered therapy. And in fact, there's some research going on literally beneath my feet down on in our Faculty of Health at Vic Uni, and they're doing some research around the effectiveness of internet-delivered anxiety management or anxiety treatment programs. And there are some really good ones about. So that's great. The other thing I put there is mindfulness. Mindfulness, as some of you be aware, is kind of like the term of the day. Everything, it seems, is delivered with mindfulness at the moment. And I'll put my hand up. I'm a fan of mindfulness, and I do mindfulness as a regular practice. However, is it helpful for dealing with anxiety disorders? Possibly not too much. It could be a useful component, but it in itself is probably not going to cut the mustard. So, but it's just useful to talk about because I think it's such a buzzword at the moment that it's useful to touch on. So look, there we go. We've come to the end. I'm going to stop my screen share so that I can come on. So look, I hope you've got something out of that. And I hope you've got, I hope you've got some questions? I hope you've got some questions, but they're not too hard. So I think Hedwig is going to facilitate that discussion, yeah?
Yeah, Nami Hinui. That was amazing. Thank you, Dougal. Very, very nice and thorough explanation of this phenomenon, which seems to be ubiquitous, yeah, and it's also something everybody can really relate to a little bit. And when it gets to the extent that it's not manageable, it's really helpful to seek help for, yeah.
Yeah.
Thank you so much. Yeah, we do have a couple of very interesting questions, so I'm just going to read them out to you,
sure,
if that's all right. So one question was, if the diet of the child would affect their mental health.
Look, in some ways, I think, of course, because we're holistic people, right? So when our mind and our brain isn't cut off from the rest of our body, so what goes into your body is going to have some effect, right? So if you're not having a decent diet, it could have some effect. It's probably not a major factor in most cases of anxiety, but I think it's always, you know what, we talk about 3 pillars of well-being. We talk about diet, exercise, and sleep. And you need those 3 pillars to have a good foundation of mental well-being. So even if diet, or what you eat, I don't mean dieting, I mean what you eat, even if it's not directly related to anxiety, it's useful to think about what's going into your body, because it's, you know, diet, exercise, sleep, foundational pillars for well-being. Whether they're strongly connected to anxiety specifically, probably not, but it's a great thing to be aware of.
Yeah, great, thank you. And then another one is, if you think a factor in anxiety being more highly reported in females might be that it's associated with the way that females and males are socialized differently, and if there's any research on that?
Hedwig's probably more the expert on the research side than I am, but yeah, look, I definitely think that in our culture, and being a guy myself, you know, there are all these pressures for how we should, pressures is possibly the wrong word, subtle messages about how we should respond and react with our emotions. So yeah, I definitely think there's a social aspect to a shaping aspect to why women may present more with anxiety than males. I don't think it's solely genetic at all. Even if it's genetic, I don't even know if there's a touch of genetics in it, but I think how we're shaped by society that we grow up in. Look, the encouraging thing I will say about that, for those of you who are like me over the age of 30, some of you a little more, we grew up in an environment where we didn't really talk about emotions a lot. Yep. But what's a really encouraging thing is working here at uni, young people, the cohort, the generation coming through, talk about mental health and well-being all the time. They're really fluent in it. Now that can create a bit of problems because the next generation up kind of goes, what are you talking about? I find this really weird and don't know what to say. Whereas the young people go, oh, we talk about our mental health all the time. So, so I think there are some encouraging signs about young people of all genders being able to talk more freely about their anxiety and their emotional well-being. And I think that's a good thing.
Yeah, fully agree. Yeah, that's amazing, actually. Yeah. Another interesting question. Before sorry, no, it was actually here. There are so many migrants families in New Zealand, and kids and children might actually have experience anxiety when migrating to a new country, and especially if parents create anxiety environment in the home potentially. And the questions are twofold. So one, if there are any strategies you would advise helping cross-cultural parents, and the other one, if New Zealand has bilingual psychologists.
Oh, wow. Okay. Let me write. Oh, you might have to remind me of the second one. So are there any strategies to work with migrant parents who are anxious? Look, that help has probably best come from communities that are similar to them. We know that the best people to help one another are those that are most similar. So yes, and there are some really good services within Wellington. So there's, I always think of the old name. It used to be called Refugees as Survivors, but they'll say it's not called that anymore. That's what it used to be called, but they are specialists in working with migrants, particularly from traumatic backgrounds who've come across. And I think you really have to think about that for migrants as the concept of trauma. What have they come from and what have they had to endure to get here? Are there any bilingual psychologists in New Zealand? I hope so. I can't hand on heart tell you who they are. I'll tell you two sites to go through to check out though. One, New Zealand College of Clinical Psychologists. The second one is the New Zealand Psychological Society. Between those two, they cover pretty much most of the professional psychologists in New Zealand. And you can do a search within each of their websites to look for psychologists. And you may well be able to find people who are fluent in different languages as well. So I'm sure they exist, but exactly how many they exist in each in each different language, I'm not sure of. Certainly, I know I've had to work with interpreters before when we're dealing with families whose English is not their first language. That's a complicating factor, as any of you that have worked with interpreters will know, because it's going through somebody else, but it can still be done. But again, if you can find somebody from that community, it's probably going to be more effective than me.
By the way, the same person says that the photo that was with the letter with the kids is maybe from a Chinese village that they know.
It could be.
That
yes.
Cliff Village has become famous tourist attraction.
Oh, there you go. There you go. Yep.
There we go.
I'll tell you, I just stole it off the internet. So yeah. But I do remember that it was a village about kids having to go up that crazy ladder, which kind of shows that, you know what, if we can do a lot of things which seem like pretty risky, and we can do them fine.
Another interesting question: if you think that it could be that somebody experiences anxiety without knowing it, and if you would consider that to be a good or bad thing,
that they're experiencing it without knowing it, is that a good?
Basically, a case in which the victims do not know that they are living with anxiety.
Oh, look, the immediate thing that springs to mind with that question is what I was like as a teenager. I didn't know I was suffering from anxiety. I remember having a whole lot of medical tests and having, because I experienced it in my stomach. So I used to get a really upset stomach, and I didn't know, and doctors would go, oh, we don't know what's going on. Maybe he's got an ulcer. Maybe, this was back in the day. This was like in the 80s. We didn't know so much in the 80s. Would it have been useful for me to know that it was anxiety? Yes, because I would have known what to do about it. So I think that not knowing is not helpful. Remember, knowledge is power. It can be difficult sometimes, though, if you find out that you're anxious and go, oh my God, is that what it is? And it might be a bit of a, oh. But to me, I think personally, knowledge is power. Knowing what's going on for you is really important. Yeah, that's my thought on that.
That's very cool. Yeah. Related to that, another question that goes into this direction. So when you then actually want to bring that up with the child, so before you actually start the letter process and any exposure, well, what is the best way to explain that, to explain what anxiety is? And if you have any advice, if there are any good videos out there for 10-year-olds about anxiety and recognizing it.
Or 10-year-olds. Look, do you know what? I'm assuming that the person asking that question is a parent, right? as a parent, you may not be the best person. You may not be the best person to have that conversation. It might be somebody else. Because as a parent, your job isn't to be the psychologist, to be the therapist. Your job is to be the support crew, the comforting arms that they go to when they're really upset, and to support them on. And because often I've seen it and the reason I'm saying this is often I think it can create tension between parents and kids. That a parent's trying to say, I think you're really anxious. I'm not anxious, you don't know what you're talking about. Well, I think you are. Don't go there. I think, a first step is going to see somebody that's independent a little bit. And I'm not trying to say everybody needs to see a psychologist. It could be that it's a wise family relative or friend, somebody the kid and the parents trust. It could be that you go to your GP. It could be that you go and see a psychologist. Yeah. But I think trying to tell somebody else what they're feeling, particularly if you're the parent, runs a few risks of you butting heads with them. So helping them explore it together. It's not a video, but there's a really good book.
Oh, yes.
And of course, I don't have it. The book that I'm thinking of is called Helping My Anxious Child. I think that's what it's called. The author is Ron Rapee. Rapee is R-A-P-E-E. And if you've got a really good memory, you'll remember that he's the guy that wrote the Cool Kids program that I talked about. I think it's called Helping My Anxious Child, but look up his name. It's something like that anyway. It's a brilliant parent guide to steps to helping your kid. And we often recommend that first. So that'll take you through things to say, what to say, how to help them without having to see a psychologist. It's written by a psychologist, which is cool, but it might. So that's a resource I'd recommend.
That's really cool. Yeah, thanks. Another question was if there is a link between anxiety and body image issues.
There could be, yes, for some people. If you remember one of the first slides we talked about 14-year-old Tony, perfectionist, worried about everything. That could easily develop into being worried about how I look, how I physically look. Now, it won't be the case for everybody, so don't hear what I didn't say. I didn't say that everybody that thinks like that is going to develop body image issues. But it could mean, it could develop into being perfectionistic about your image and about your weight and about your body. So yes, for some people, that can be a pathway.
Yeah, good to know, yeah. And another one, if a child is distressed after being somewhere we have not been before, like daycare, should we investigate somehow before assuming that the child just has to get used to it?
Oh, look, I think the principles of that guided of a stepladder approach is a really useful thing for anywhere that a child feels anxious about going. It doesn't, if you think about daycare, often you do little visits. Oh, well, we're going to come along and mum and dad will stay, or mum or dad, doesn't matter, or mum and mum, who doesn't matter. Parents will stay for a little bit of time. And then we'll go away and then we'll come back and we'll do it a bit longer. It's the same principles of graded exposure. You're getting used to being there. So you might have to do that. You might have to do that for a situation that a child becomes anxious in. And you can do that yourself as long as the anxiety is manageable. If they're 10 out of 10 worried and freaking out, it's like, okay, we need to get out of here and we'll start again. But there's lots of times in natural life that you do a graded exposure where you just gently get into it and you try it out and you try it out and you try it out a bit longer and a bit longer. And school visits and preschool visits are a classic example of those.
Yeah, very good point. Yeah. So it's kind of doing it in a different way, and it's probably also what we do with ourselves sometimes, just getting used to it. Yeah,
getting used to it. Yeah, got it. Yeah, well said.
Great. I'm gonna squeeze in a last question, if that's okay.
Yep.
Which is if you think, or if there's some research around if it's more if CBT is more helpful for anxiety in children with neurotypical children in comparison with neurodivergent ones.
Look, there is a whole program. There are specific programs for kids who are neurodivergent. And it's a big thing with, particularly with kids on the autism spectrum. Anxiety is often a part of that. So yes, they can be helped, and yes, but that's often doing a specific program with them. I think, I'm going to stick my neck out here, I think Cool Kids has even developed one for kids who are on the spectrum, but that may, you know what I'm going to do after we finish, I'm going to go away or Google it and go, have they, or have I just told a lie? But I'm pretty sure they, and I know there are programs set up from time to time for neurodivergent kids, because they see the world in a different way, right? And we need to take care of their specific needs.
Yeah, I think the question was also in the direction of ADHD.
Oh, yeah. Yes, well, okay. Look, same thing. I think for ADHD, the core difficulty is going to be keeping them on task. You know, and so having a session with a kid who has ADHD at 4 o'clock in the afternoon after they've just done a whole day of school is probably not going to be the best thing. You might want to do it at 9 o'clock in the morning, which I know interferes with school, but you know, pluses and minuses, right? So we frequently would see kids with ADHD and anxiety, and just as effective.
Okay, yeah, and we probably there's also some things. Not everything works for everybody, so it's also to figure these things out. Yeah,
for sure, absolutely.
Yeah. Great. Thank you so much, Namihinui, Kia ora, Dougal. That was really interesting and such a great discussion as well. Thank you all for your great questions. And yeah, hope to see you another time again. Thanks, you, Dougal, and have a nice evening.
Thanks, everybody. Thanks for coming. Cheers.
Kia ora.
See ya.
Mā te wā.